World Health Organization experts said eating processed meat can lead to bowel cancer in humans, while red meat is a likely cause of the disease. The France-based International Agency for Research on Cancer, or IARC, part of the WHO, put processed meat such as hot dogs and ham in its Group 1 list, which already includes tobacco, asbestos, and diesel fumes, for which there is sufficient evidence of cancer links.
The IARC working group concluded that processed meat, that is, the consumption of processed meat, is carcinogenic to humans, and that the consumption of red meat is probably carcinogenic to humans. These findings reinforce existing dietary guidelines from a number of health authorities, including the World Health Organization. That is, that people who eat meat should consider reducing their consumption to reduce their risk of several diseases, including cancer.
Red meat, under which the IARC includes beef, lamb, and pork, was classified as a probable carcinogen in its Group 2A list that also contains glyphosate, the active ingredient in many weed killers. The lower classification for red meat reflected limited evidence that it causes cancer. The IARC found links mainly with bowel cancer, as was the case for processed meat, but it also observed associations with pancreatic and prostate cancer. It estimated each 50 grams of processed meat eaten daily increases the risk of colorectal cancer by 18%. Loomis said it's important to note that the category A certain substance is placed in does not necessarily correspond to the level of risk, but rather the strength of research backing the claim of a risk existing.
Processed meat has been classified as carcinogenic along with other well-known substances, including tobacco smoking and asbestos, even air pollution. But it's important to recognize that those classifications relate to the strength of scientific evidence for carcinogenicity and not to the level of risk. So even though they're all in the same category, the level of risk for tobacco smoking, say, is much larger than the risk associated with eating meat. 10 times larger than the risk for processed meat, for example.
The preparation of the IARC's report has already prompted vigorous reactions from meat industry groups, which argue meat forms part of a balanced diet and that cancer risk assessments need to be set in a broader context of environmental and lifestyle factors.